This interview was recorded at the Psychedelic Science 2025 in Denver, where we spoke with leading voices in psychedelic research, therapy, spirituality and policy. Dr. Bessel van der Kolk is a world-renowned trauma expert and the author of the groundbreaking book, The Body Keeps the Score. As a principal investigator in MAPS MDMA-assisted therapy trial for PTSD, he bridges neuroscience, somatic therapies, and psychedelics. In this interview, we talk about how trauma is stored in the body, how psychedelics can unlock healing, and what an ideal trauma-informed psychedelic therapy could look like. How would you define trauma?
Trauma is an event that's an experience that overwhelms your mental and physical capacities to take action and to do something. It's an experience of helplessness and overwhelm, and then something happens in your mind and your body that may keep you stuck there. So you keep reliving and replaying it over and over again, yeah.
So my understanding it's not enough that something bad happens to you to traumatize you, but you need something more, right?
Everybody has had lots of bad experiences, yeah.
So what is it that is more than just a bad thing that happened to you?
It is when it really messes you up and it really leaves you there, it keeps you stuck there. And we all have heartaches and we lose people and we go through grief reactions. And so every life is difficult in its own way, but the trauma is something that sort of keeps you there. You really don't go on with your life. Yeah.
What do you think, why just talking therapy in itself is not enough to heal you from trauma?
Why would you think that talking therapy helps with a deep rearrangement of your sensory motor system of your brain? Like, no. Yeah. So talking is helpful to have a sense of knowing what happened, allowing yourself to talk about what happens, finding language for yourself, being able to convey to other people what is troubling you, but being able to talk about it does not cure the trauma per se. Yeah.
In your book, The Body Keeps the Score,
yeah.
You describe many somatic or body-based methods to heal from trauma, such as yoga.
I describe 13 different ways of approaching it. Yeah.
Quite a lot.
Body-based is one of them.
Yeah. So can you explain the mechanism, how they work? Like, why is it that, for example, a rhythmic movement of the body can heal us from trauma?
Well, we don't know much about how anything works. That's always important. And people come up with simple explanations I tend to call biobabble. They throw out some biological terms and everybody goes like, wow. But I happen to be a neuroscientist and I know that most of those explanations don't explain anything. How do things work? We studied how EMDR works, for example. EMDR is a very good treatment for trauma. And what we saw is that the connectivity in the brain changes. And so different parts of the brain get connected with other parts of the brain that allow the mind to have a new perspective on things. That's probably what happens in psychedelic agents also. It allows new pathways to be opened up in your brain and give you more of a sense of time, like that happened then, it's not happening now. So your brain capacities change as you do any of these treatments. Yeah.
So you were a principal investigator, or you're a principal investigator in the MDMA study done by MAPS?
One of them, one of the sites. Yeah,
Can you explain what the principal investigator is doing and what were your experiences?
What was I doing? That's a very good question. I didn't do very much. I listened to all the cases that came in, and we talked about all the cases as they went through it. And then I wrote up a good part of the data for the final papers, actually. I got to write up the best part of the study, actually, yeah.
What have you learned from that study?
What we found, actually, for me was very profound, is that, because we're sort of living in this DSM world, which to my mind is not a very good world to live in because there's no science behind the DSM, but somehow people live with these inadequate psychiatric diagnosis. So in order to get the drug approved, people studied how did the PTSD symptoms change. But these drugs are not specific for PTSD. They change your mind. They change the way you think about things. And so I put in some measures about self-regulation, some measures about alexithymia, the inability to know what you feel and being out of touch with your body. And we put in a self-compassion scale. And what we saw is that even people with long-standing horrendous trauma got a deep sense of self-compassion and a deep sense of self-protection and a deep sense of feeling what they went through, not blaming themselves anymore. The shame tended to disappear, and people were able to regulate their emotions much better. So they didn't get as angry as before, or as upset as before, as panicked as before. So there was something happened to the regulatory mechanisms of the brain. It's very profound, actually. Yeah.
Do you think this is specific to MDMA, or other psychedelic substances could produce the same?
So MDMA is not legal in the United States, and so I never give people illegal drugs. So in the MDMA study, we give MDMA. The only legal drug in the US is ketamine. And I'm very happy working with ketamine. I'm very contented, and I'm not sure if there's advantages of MDMA over ketamine or the other way. I'm quite contented with having that one drug I can work with, actually. Yeah.
Do you think that those somatic methods you promote, such as yoga or dancing, can be combined with psychedelic treatment?
Yeah, you can combine anything with anything. And so I wouldn't do yoga while I'm in an altered state of consciousness necessarily. Or I have a chapter on psychodrama, very, very effective treatment. We have done 2 experiences with psychedelic medications, combining it with psychodrama, and people liked it very much. Yeah. Whether it is very much better than doing it separately, I don't know. Yeah.
The main theme of this conference is integration. Can you talk about why is it so important to integrate these experiences?
Well, it's important to really feel what you feel and to be able to spend some time on that and to really pay attention to your internal processes and get to know yourself better. And the real big thing with psychedelics is I just love the word psychedelic. Humphrey Osmond coined it. It means mind manifesting. And on psychedelic, your mind gets manifested. You get to see yourself in a different perspective. You get to feel things, you get to experience things about yourself that you may not have allowed yourself to experience before. Many people have memories come up of things that they had suppressed or that had been pushed away. And being able to say, this is what happened to me and it happened to me then, and to put it in perspective and to really take your time to integrate it into your larger perspective is terribly important. And so one of the things that I and Rick Doblin and other people are very worried about is that the people use psychedelics the way you use Prozac. So you just take this pill and go away. We are very much, this is about psychedelic-assisted psychotherapy, where you actually have an experience and you process your experience and you really spend time on taking care of that creature who you are. Yeah.
So it's more like the experience that is healing, and it's not the substance, right?
No, the experience of getting to know yourself is very important, and being able to find words for it and communicate about it is very important. Yeah.
And what do you think about those efforts of some pharmaceutical companies that would like to divide the two, and develop drugs that are psychedelic but without the psychedelic treatment?
If greed is the only incentive that you have, you should definitely do that. Yeah. It's not how you get people better. If you want to make a lot of money, you do that. But no, my job is not to make a lot of money. My job is to get people better, actually.
So what would you recommend to trauma survivors if they are considering to undergo psychedelic treatment? How can they know if that's good?
Well, it's tricky because it is not legal in many places. And oftentimes some people are well known or have written about it, and so you have some names. But the best way to find a therapist is word of mouth. Is to say, have you ever done psychedelic therapy? What was it like with that particular person? But the best thing is to ask your friends and your neighbors and colleagues who they have had good experiences with. Yeah.
What are the risks, if there is any? Risks?
The risk is to be left alone in very dark places. So that, certainly in the MDMA study, everybody went to very dark places. And so being where you are, the setting is terribly important. Who is with you is terribly important. And if you have some of these old feelings coming back of having been raped as a child, something like that, which are experiences that people have, it's very important to have people be with you who can hold you, who can comfort you, who can be there for you in a compassionate way. It's a very important part of it. Yeah.
How can we train therapists who can engage in psychedelics?
Well, the first thing is you have to take it yourself. If you haven't taken psychedelics, you don't know what it does. And the most striking thing about psychedelics is you never know what your mind will reveal to you. One day you take it and you see glorious, beautiful things, and the next day you see human misery and pain and horror. You never know what will come up. And so you need to be prepared for, I'm of a certain age, and we took LSD in college, and I used to say back then already, when you take LSD, you can meet the good, the bad, and the ugly. You have to be prepared to see very painful things and to be with people who can be there for you when you go through it.
Do you think psychedelics have a space beyond clinical use?
Yeah, it all depends on your frame of mind. So I'm a physician, I'm a professor, so the medical model comes easy for me. Or you have a particular diagnosis, you have a particular problem, but that's not why these medicines came into the world. They came into the world to expand our consciousness. And so if you have a medical model, you go like, oh, you have that particular diagnosis, we're going to help you with that. But if you don't have a medical model, you take these things in order to expand your consciousness and to have a deeper appreciation of life. Yeah. It all depends on your frame of mind, basically. Yeah.
If you look at humankind in general, how do you see our future as a species?
Well, I wish you had asked me that 2 years ago. I think right now, of course, we live in a time that is... It's interesting, living in the trauma world and having been there quite in the center for a long time, is that we really thought that we would make the world a better place. And we saw the world becoming a better place. And we sort of thought, oh, maybe the world is becoming a better place because of us. And now that the world is becoming a worse place, we're not saying, oh, the world is becoming a worse place because of us either, But I think people tend to underestimate what a troubled species we are. Something of great interest to me is, I travel a lot, I've been to a lot of places, and I know history pretty well. And I'm always curious, is there any society that managed to live without violence and that lived at peace for any length of time? And there haven't been any. There's something about human beings that if things get good, they need to destroy it. And people have done that, at some point, and people thought, oh, maybe those old native people of the Americas, they really found it. And you go down to Aztec world and to Mayan world and Inca world, they did terrible things to each other. So they didn't put it together. The Chinese never put it together. Indians never put it together. Nobody ever really was able to do it. And that cruelty and that othering of people keeps coming back. I must say that the psychedelic world in that regard is pretty good. I've studied all the different methods, and to some degree, what I'm interested in is when people say this is really very effective, does that mean that the people who practice it are kinder, wiser, more thoughtful people? And usually, no. But psychedelics do tend to make people wiser, calmer, and less reactive and less into getting angry and blaming people and projecting things on other people. So psychedelics, by and large, seem to be pretty good overall for people to get along with each other.
Yeah. If you listen to Rick Doblin, he says that we will create world peace with psychedelics.
I think that's a beautiful thing for Rick to say.
Do you agree?
But only Rick would say that.
Okay.
But when people say Rick says that means he is an idiot, I go, no, I think it's a beautiful thing to say, to dream of this being possible. And I hope he's right. Yeah.
How do you see Rick's and MAPS contribution to?
Oh, I think Rick is, I have very deep love and admiration for Rick, actually. I think what he has fought for, what he has accomplished, how he has been able to put things together, despite immense opposition, is very admirable. I'm a great admirer of Rick Doblin, actually. Yeah.